arterial blood pressure. So if you will define blood pressure, it will mean the lateral pressure that is exerted by the column of blood on the wall of blood vessel. It is called as blood pressure. This is the column of blood and this is the direction of blood flow, but the pressure that is laterally exerted over the wall of the blood vessel, it is called as blood pressure. Here we are talking about the arterial blood pressure. So we can say the lateral pressure that is exerted by the column of blood on the walls of arteries, it is called as arterial blood pressure. Now there are two terms, diastolic blood pressure and systolic blood pressure. So what is systolic blood pressure? As the name suggests, the maximum pressure that is exerted during the systolic phase. Okay. Systolic phase of cardiac cycle. It is called as systolic blood pressure. And the normal value, it is around 120 to 140 mmHg. Now this systolic blood pressure, it is mainly determined by cardiac output. It's a major determinant. Now if we talk about diastolic blood pressure, it is the minimum pressure that is exerted during the diastolic phase of cardiac cycle. That is, this pressure, it is exerted before the starting of ventricular ejection, whereas systolic pressure, it is exerted during the phase of ventricular ejection. Now about the normal value of the systolic blood pressure, it is around 80 to 90 mmHg. Okay. And the major determinant for this diastolic blood pressure, it is your peripheral vascular resistance. Okay. More will be the peripheral vascular resistance, higher will be the diastolic blood pressure, and fall in the peripheral vascular resistance, it will lead to decline in the diastolic blood pressure. Okay. After that, there is another term which is called as pulse pressure. Now what is pulse pressure? Pulse pressure, it is the arithmetic difference between systolic and diastolic blood pressure. So it can be written as systolic blood pressure minus diastolic blood pressure. And the normal value, it is around 40 mm of H. Okay. Once we have discussed about systolic blood pressure, diastolic blood pressure and pulse pressure, there is one another term that is called as mean arterial pressure. So what is mean arterial pressure? It is the average of all the pressures during cardiac cycle. Okay. During cardiac cycle. Now coming towards the formula, here is the formula for the calculation or determination of mean arterial blood pressure. Diastolic blood pressure plus 1/3 of pulse pressure. That is how you calculate mean arterial blood pressure. Okay. Normal value, it is around 90 to 110 mm of H. Okay. So that was all about the 4 types of blood pressure. We discussed about the definition, what is systolic blood pressure, what is diastolic blood pressure, what is pulse pressure, and mean arterial blood pressure.